Welcome to PlacidWay Pulse, your trusted guide to global healthcare, medical tourism, and, finding world-class treatment opportunities abroad.
Yeah, it's great to be here.
So if you've been considering medical travel for anything from advanced healthcare to cosmetic surgery, or maybe cancer care, stem cell therapy, even dental procedures, well, today's deep dive is absolutely for you.
Exactly, because today we are looking at why South Korea has become, truly one of the world's top destinations for medical tourism.
Right. And how PlacidWay helps international patients actually connect with these trusted hospitals and specialists and, do it with confidence. But before we get into the weeds, let me just pose a question to you listening to this right now. If I say South Korea, what image immediately pops into your head?
Probably K-pop, right?
Exactly. Yeah. For most of us, it's this very specific, highly curated highlight reel. You picture the global dominance of K-pop groups filling stadiums. Or maybe, you think of that ultra-sleek smartphone sitting in your pocket right now.
Or the food, the incredible Korean barbecue.
Oh, definitely the food. But I am willing to bet that your first thought was not a massive multi-billion-dollar industrial complex that systematically draws, get this, 500,000 international visitors to the country every single year.
It's a staggering number when you actually pause and think about it.
It really is. And to be clear, those 500,000 people, they are not boarding 14-hour flights to attend a concert.
No, not at all.
And they aren't going for sightseeing. They are traveling across the globe specifically for advanced, often life-altering medical care.
Right. And when you consider the logistics of that, 500,000 people navigating foreign customs, language barriers, long flights, all while in a state of medical vulnerability. Human beings generally want comfort and proximity when they're sick.
Early, you want your own bed.
Exactly. We tend to categorize countries by their cultural exports because it's comfortable. But what the PlacidWay data shows us is that South Korea has quietly and with immense intentionality engineered itself into a completely different category.
A globally dominant healthcare powerhouse.
Yes, exactly that.
And that intentionality is exactly what we're going to unpack today. Our mission for this deep dive is to figure out the mechanisms behind this massive shift.
Right, because it didn't just happen by accident.
No, it didn't. We are pulling heavily from a stack of comprehensive guides, internal data, and patient outcome reports provided by PlacidWay. And for context, if you don't know, PlacidWay is a major medical tourism facilitator platform.
They're essentially a centralized hub.
Right, a hub that connects international patients with trusted hospitals abroad, providing transparent pricing and vetting the specialists. And I have to say, coming through their South Korea data is genuinely eye-opening.
It really reframes everything you think you know about global medicine.
It does. We are going to explore the intersection of, next-generation medical technology, the economic realities that allow for these surprisingly low costs compared to Western medicine, and just the gritty logistics of how a patient actually manages a major surgery on the other side of the planet.
And I think the broader context here is that this is not simply a conversation about budget travel, It's not just looking for a discount on a minor procedure.
No, definitely not.
The PlacidWay data points to a deliberate structural shift in global infrastructure. We're analyzing a sovereign nation that has actively designed its urban planning, its legal frameworks, and its digital architecture, specifically to cater to a borderless patient population.
Which completely upends the traditional paradigm, right? Where you're geographically bound to whatever local healthcare system you happen to be born into.
Exactly. It challenges that entirely.
So I want to start by looking past the cultural gloss, because there are a lot of entrenched realities and equally entrenched myths surrounding what is casually referred to as K-medical.
Oh, absolutely. There's a
Yeah.
giant elephant in the room we have to address first.
Right. The prevailing myth in the West is that South Korea is exclusively a destination for plastic surgery. People just assume it's a giant factory for rhinoplasties and facelifts.
It is an incredibly pervasive myth. And, like many myths, it is rooted in a highly visible kernel of truth. The statistics do confirm that South Korea possesses the highest density of plastic surgeons per capita anywhere on Earth.
Wow, anywhere on Earth.
Yeah. They have definitively earned the title of the global capital for aesthetics. But if you look at the actual patient intake data across the country, aesthetics represent only the tip of a massive iceberg.
So what's the rest of the iceberg?
A tremendous portion of those 500,000 annual visitors are traveling for highly complex internal medicine. We're talking about critical organ transplants, advanced oncology and cancer treatments, and major orthopedic and spinal reconstructions.
See, that is the part that fascinates me because I can understand how a private, lucrative industry like cosmetic surgery could organically explode in a country that clearly values aesthetics.
Sure, market demand drives that.
Right. But how does a nation just pivot to become a world leader in complex life or death internal medicine for foreigners? Having brilliant local doctors is one thing, but building the infrastructure to handle hundreds of thousands of sick foreigners requires something else entirely.
It requires state-level intervention. And frankly, it did not happen organically. The South Korean government officially designated medical tourism as a strategic growth engine.
What does that actually mean in practice?
Well, to understand the impact of that, we have to look at how healthcare grows in most Western countries. Usually, it is either a decentralized, market-driven expansion by private hospital networks, or it's a slow-moving, heavily bureaucratic public system.
Like the NHS or Medicare.
Exactly. But in South Korea, this was a top-down, fiercely funded national initiative. The Ministry of Health and Welfare didn't just suggest that hospitals take foreign patients. They poured massive government subsidies into medical technology acquisition.
Wow. So they literally funded the tech.
Yes. And they implemented stringent, internationally benchmarked regulations. They literally zoned and funded specialized medical cities designed from the bedrock up to treat a global influx of patients.
I read about these medical cities in the PlacidWay guides, and the technology they mandate is just incredible.
It's next level.
The sources highlight the widespread integration of the Da Vinci robotic surgical systems, and, they aren't just sitting in one flagship hospital in the capital as a showpiece. They are the standard of care across these hubs.
They're ubiquitous over there.
Yeah, and they are utilizing AI-driven diagnostics to process pathology reports. But the thing that really stood out to me were these one-stop diagnostic centers.
Oh, those are amazing.
Right. The materials describe a process where an international patient can walk in, undergo a comprehensive full-body diagnostic workup MRI, 3D CT scans, comprehensive blood panels, endoscopic exams, and receive interpreted results the very same day.
Often within just a few hours.
That's insane.
To put that into perspective, in many Western healthcare models, that exact sequence of diagnostics would take months.
Oh, easily.
You wait 3 weeks for a specialist referral, right? Then another 4 weeks to get time on the MRI machine.
And then 2 more weeks for the radiologist to actually interpret the scan and send it back?
Exactly.
Yeah.
The sheer velocity of the Korean system is not because their doctors are rushing. It is a direct result of that top-down integrated infrastructure that simply eliminates friction between departments.
Reading through the way these hospitals operate, the best analogy I could come up with is a highly integrated digital tech ecosystem.
Oh, I like that. How do you mean?
Well, think about when you buy into a premium smartphone ecosystem, your phone seamlessly talks to your smartwatch, which instantly syncs with your laptop, which is backed up to your cloud. Everything uses the exact same underlying language, so there are no bottlenecks.
That's a perfect comparison.
The data suggests Korean hospitals operate on a similar digital philosophy. Because they built these medical cities specifically for this purpose, the integration of electronic medical records, or EMRs, and smart hospital networks means the cardiology department is instantly talking to the oncology department.
Right. There's no losing of facts between offices.
Exactly. And because the billing is centralized and transparent, the patient isn't left fighting a labyrinth of different departmental codes.
And that ecosystem analogy works so well because it highlights the removal of administrative friction. But, the consequence of that frictionless environment goes far beyond mere convenience for the patient.
Where else does it show up?
It directly translates to tangible, life-saving clinical outcomes. The quality metrics are where the system really proves itself. For example, South Korea currently boasts a 5-year survival rate for gastric cancer that exceeds 75%.
Wait, gastric cancer is notoriously difficult to treat. How does a 75% survival rate compare to the rest of the world?
It is vastly superior to the global average. It significantly outpaces the rates found in both the United States and major European healthcare systems.
Wow.
And understanding why they excel at this specific metric is a great window into their medical culture.
Because it's not just random luck.
No, not at all. Historically, due to certain dietary factors in East Asia, gastric cancer rates were high. So, in response, the Korean government instituted national mandatory endoscopy screenings for all adults.
Oh, I see.
Yeah, this created an environment where surgeons were finding cancers at incredibly early stages. and performing thousands upon thousands of corrective surgeries. They built unparalleled institutional knowledge.
So they essentially turned a regional health vulnerability into a globally unmatched surgical expertise just through sheer volume and government mandate.
Exactly that.
Okay.
Furthermore, that institutional knowledge is augmented by intense, continuous training. The cultural emphasis on mastery in South Korea means that finishing medical school is just the baseline.
Right, it's just the start.
Korean specialists routinely undergo years of additional, highly competitive fellowship training abroad. They immerse themselves in the top surgical theaters in the US, Germany, or the UK.
And then bring it back home.
Yes, they bring that cutting-edge global expertise back to Korea, but they don't just replicate it. They blend it with traditional Eastern holistic approaches.
The source material touched on that briefly, the blending of Eastern and Western medicine. But how does that actually manifest in a modern AI-driven hospital? It seems like a contradiction to me.
It sounds like it, but it's actually a highly complementary dual approach.
Mm.
The Western side, the robotic surgery, the targeted proton therapy, the AI diagnostics,
Yeah.
that is deployed aggressively to eradicate the disease or perform the structural repair.
Okay, that makes sense.
But the Eastern philosophy is deployed for patient recovery and holistic well-being. So a patient might undergo a highly advanced robotic spinal fusion,
Right.
and their post-operative care will certainly include standard Western pain management, but it may also integrate customized herbal anti-inflammatories, targeted acupuncture for postoperative nausea, and specialized nutritional therapies designed to balance the body's systems.
So you are treating the disease with absolute surgical precision, but you are treating the human being's recovery with a deeply holistic, centuries-old methodology.
You nailed it.
I love that concept. Eradicate the problem with the robot, heal the body with the holistic tradition. So, okay, we have established the technological ecosystem, the aggressive national funding, and the undeniable quality metrics.
Yep, the foundation is solid.
But I'm going to put on my heavy skeptics hat right now because the most pressing question, the single biggest barrier for anyone listening to this and considering medical travel is the price tag.
Always. Cost is always the deciding factor.
Right. If a system is utilizing multi-million-dollar robots, highly trained surgeons, and luxury medical cities, basic economics suggests it should be prohibitively expensive. It sounds like healthcare designed exclusively for billionaires.
And this is where we encounter the massive paradigm shift of global medical tourism.
Yep.
According to the comprehensive pricing data aggregated by PlacidWay, international patients typically save between 30% to 70% on major procedures compared to average United States prices. Up to 70, yeah.
Right.
And they are achieving these savings while accessing the exact same, if not better, technology and quality standards we just discussed.
Okay, I have to challenge this directly. Human nature, especially in the West, dictates that price and quality are inextricably linked.
You get what you pay for, right?
Exactly. If you tell me I'm saving 70% on a life-altering spinal fusion or a complex cancer treatment, my immediate instinctual assumption is that someone, somewhere in that hospital, is cutting a massive corner.
Of course.
Are the materials cheaper? Are the hygienic standards lower? How can we possibly reconcile a 70% discount with world-class robotic-assisted care?
It is the single most important question a prospective patient can ask. And to answer it, we really have to completely dismantle our ingrained understanding of how healthcare is priced.
Which is hard to do.
Very difficult, especially for those of us conditioned by the U.S. medical economy. The lower costs in South Korea are absolutely not derived from cutting corners, using subpar implants, or relaxing safety protocols.
Then where do they come from?
The savings are the mechanical result of a fundamentally different national economic model.
Break that mechanism down for us. If the implants cost the same and the robots cost the same, where does the 70% margin actually come from?
The savings stem from three primary structural pillars. The first pillar is the macroeconomic reality of the country itself.
Okay.
The overall cost of living, the baseline real estate costs for the hospitals, and the broader labor dynamics in South Korea create an environment where the baseline cost to deliver any complex service is simply lower than in New York or Los Angeles.
Makes sense. Rent is cheaper, baseline salaries are different.
Exactly. The second pillar is the eradication of administrative overhead.
You mean the billing departments?
Precisely. Consider the sheer size of the administrative apparatus required to run a hospital in the United States. A staggering percentage of a patient's final bill does not go to the surgeon or the equipment.
It goes to paper pushers.
Right. It goes to an army of billing coders, insurance liaisons, compliance officers, and legal teams managing liability protections. South Korea operates under a highly streamlined, government-regulated system with standardized pricing models.
So they just don't need that army.
Exactly. That massive, bloated layer of administrative middlemen simply does not exist to the same degree, meaning the patient is paying almost exclusively for the medical care itself.
That makes a lot of sense. The digital ecosystem we talked about earlier essentially automates the bureaucracy that costs billions in the U.S.
Exactly.
So what is the third pillar?
The third pillar, and arguably the most impactful when it comes to surgical precision, is economies of scale driven by extreme volume.
Walk us through how volume lowers the price of a surgery.
Think about the fixed costs of a multi-million-dollar Da Vinci robotic surgical system. If a hospital in a mid-sized U.S. city buys one and performs 5 surgeries a month with it, the cost to amortize that machine per patient is astronomical.
Right. Someone has to pay for the robot.
Yes. Now, take a specialized hub in South Korea where that exact same machine is running constantly, performing hundreds of specific procedures a month. The cost per surgery plummets.
Oh, wow.
But the hidden clinical benefit of that volume is surgical mastery. A surgeon who performs a highly specific spinal fusion 50 times a week develops a level of efficiency and muscle memory that is impossible to match for a surgeon doing it 5 times a month.
So the efficiency drives down the time in the operating room, which drives down the cost, but simultaneously drives up the quality because the surgeon has exponentially more reps under their belt.
Exactly. You are paying less money, but you are actually procuring a surgeon with vastly more concentrated experience.
I want to look closely at these PlacidWay numbers because hearing the percentages is one thing, but looking at the hard data is sobering.
It really puts it into perspective.
Let's start with cosmetic procedures, since that is the cultural touchstone for South Korea. A full facelift. In the United States, depending on the market, a patient is looking at anywhere from $15,000 to $25,000.
And frequently much higher for top-tier surgeons.
Right. But in South Korea, that same procedure runs between $8,000 and $12,000.
You are looking at a 50% reduction for access to surgeons who literally pioneered many of the modern techniques used globally.
It's wild. Let's look at rhinoplasty. $8,000 to $15,000 in the U.S. In Korea, the data shows $3,000 to $6,000.
Huge difference.
Breast augmentation. $10,000 to $15,000 in the U.S. compared to a range of roughly $3,500 to $9,000 in Korea. But I want to move away from aesthetics and look at dentistry because this is where the technology gap really shows.
Oh, the dental tech is fascinating.
Right. A single dental implant. In the U.S., this is often a month-long ordeal costing $3,000 to $5,000 per tooth. In Korea, it runs between $900 and $1,300. And the guide specifically mentioned the use of 3D CT scanners and CAD/CAM systems. How does that technology factor into the price and the experience?
Well, CAD/CAM stands for Computer-Aided Design and Computer-Aided Manufacturing. In a traditional dental setting, they take a physical mold of your mouth with that horrible goop.
Oh, I hate that stuff.
Right. Then they send it to an off-site laboratory, and you wait 2 weeks in a temporary crown while the lab manufactures the permanent one. It requires multiple visits and high lab fees.
Yeah.
In these advanced Korean dental hubs, they take a digital 3D scan of your mouth. That data is fed into a milling machine located right there in the clinic. While you are sitting in the chair, the machine precisely carves your permanent ceramic crown from a solid block in about 20 minutes.
Wait, they do it right there in the chair in 20 minutes.
Yep. The technology eliminates the external lab, eliminates the second visit, significantly drops the overhead cost, and provides a perfectly mapped custom fit in a single day.
It is genuinely mind-blowing that a system that fast and that advanced is a third of the price of the slower traditional method.
It's the perfect example of tech driving down cost.
But as impressive as the cosmetic and dental savings are, the financial gap becomes a massive chasm when we look at serious, life-altering medical interventions. Look at stem cell therapy.
Yeah, regenerative medicine.
Exactly. In the U.S., it can range wildly from $10,000 to $25,000 and is often entirely out of pocket because insurance just won't cover it. In South Korea, it sits between $3,500 and $6,000.
And that affordability in regenerative medicine opens up avenues for patients dealing with chronic pain or joint degradation who have simply been priced out of biological therapies in their home countries.
Speaking of joints, Let's talk about total knee replacements. This is a massive issue. I personally know people who are living in daily agony, but they delay the surgery because they simply cannot afford the copays, the deductibles, and the out-of-pocket maximums on their insurance.
It's a tragic reality for many.
The data shows a total knee replacement in the U.S. is billed between $30,000 and $50,000. In South Korea, utilizing the advanced robotic surgical assistance we discussed, it averages $10,000 to $14,000.
To contextualize that, a patient could fly from Chicago to Seoul, undergo a robotic knee replacement by a surgeon who does hundreds of them a month, and the total cost of the surgery is less than what their insurance deductible alone might be in the U.S.
That is just. It's hard to process. Let's escalate to the most critical procedures, spinal fusion surgery. This is major central nervous system proximity work. $60,000 to $110,000 in the U.S. In Korea, the estimate is $12,000 to $18,000. Heart valve replacement open heart surgery, $80,000 to a staggering $170,000 in the U.S. In Korea, $25,000 to $35,000.
The disparity is profound, and it extends into highly specialized oncology. Take proton therapy, for instance.
I actually want to pause on proton therapy because it is mentioned several times in the oncology data, but I don't think most people understand what it actually is or why it is so expensive. How does it differ from regular radiation?
Well, traditional radiation therapy uses X-rays or photons. When you shoot an X-ray at a tumor, it enters the body, hits the tumor, but then continues traveling through the body and exits the other side.
So it hits everything in its path.
Right. It damages the healthy tissue in front of and behind the tumor. Proton therapy uses a massive particle accelerator to strip protons from hydrogen atoms and fire them at the body.
That sounds intense.
It is. The physics of protons are unique. They can be calibrated to travel to an exact specific depth inside the body and stop completely.
Wait, they just stop?
Yeah. They stop exactly at the site of the tumor, releasing all their destructive energy right there. A phenomenon known as the Bragg peak. There is no exit dose. It spares the healthy organs behind the tumor. It is miraculous for treating pediatric cancers or tumors located near critical structures like the brain or the spine.
That sounds incredibly complex to build and operate.
It is. Building a proton therapy center costs hundreds of millions of dollars. Because of that, in the U.S., a course of proton therapy typically costs between $90,000 and $150,000.
And in Korea?
In South Korea, due to government subsidies and the economic structures we outlined, that same cutting-edge proton therapy costs between $20,000 and $30,000.
It's just a totally different world. And finally, looking at fertility. In vitro fertilization, or IVF, the emotional toll of infertility is devastating, but the financial toll often breaks families.
Absolutely.
The U.S. average for a single cycle is $12,000 to $17,000, and many families require multiple cycles. In South Korea, an IVF cycle is $3,500 to $5,000.
When you lay out the data like that, when you move past the percentages and look at the absolute dollar amounts,
Yeah.
the value proposition becomes undeniable.
It really does.
The sheer economic gravity of these numbers is what is pulling that 500,000 people across the globe. But, South Korea hasn't just opened its doors and let the market sort itself out. They have highly organized the country geographically to absorb and manage this specific influx of different medical needs.
Right. The geography of healing. This is one of the most fascinating aspects of the PlacidWay guides. The entire country is incredibly connected. They have the KTX, which is their high-speed rail network.
Very efficient.
But instead of every city trying to offer every type of surgery, specific cities and even specific districts within cities have evolved into hyper-specialized medical hubs.
The geographic layout is very deliberate.
Yeah.
How do the guides categorize these different zones?
The best way I can conceptualize it is by comparing it to famous global wine regions.
Okay, I'm listening.
If you are a connoisseur, you know exactly where to go. If you want a heavy, complex tannic red wine, you travel to Bordeaux. If you want the world's best sparkling wine, you go to Champagne. You don't ask Bordeaux to make champagne.
Right. You go to the source of mastery.
Exactly. South Korea operates the exact same way. You travel to specific districts based entirely on the specific medical discipline you require.
That regional specialization is a brilliantly efficient way to allocate national resources. Let's map this out for the listener, starting with the most globally recognized hub. The Gangnam district in Seoul.
Yes, Gangnam, thanks to pop culture. Everyone knows the name. The guides describe Gangnam as the absolute epicenter of luxury and aesthetic transformation.
A Champagne region, using your analogy.
Exactly. If you are traveling for high-end plastic surgery, cutting-edge dermatology, or luxury anti-aging treatments, this is it. The district is densely packed with clinics competing at the absolute highest level. It is fast-paced, highly commercialized, and entirely geared toward the premium cosmetic patient.
The density of clinics in Gangnam is a perfect example of agglomeration economics. Because all the top surgeons are there, all the best medical suppliers set up shop there, which draws all the best nurses.
It's an ecosystem of excellence.
Right. It creates an environment of relentless innovation and fierce competition that ultimately benefits the patient. However, if you stay in Seoul, but simply take a short train ride over to the Jongno and Seodaemun districts, the entire atmosphere shifts dramatically.
The guides refer to these districts as the heavy hitters.
Exactly. Jongno and Seodaemun are not focused on aesthetics. They are the historic and academic bedrock of Korean medicine. This is where you find the massive, sprawling university hospital.
There's smart hospitals.
Yes. These are the institutions that specialize in severe, complex illnesses, advanced oncology, high-risk cardiac care, and multi-organ transplants. They are research powerhouses. The pace here isn't about luxury transformation. It is about rigorous, multidisciplinary, life-saving intervention.
So Seoul alone is incredibly diverse. But what happens when you utilize that KTX high-speed train and head south to the coast? The PlacidWay data highlights Busan, which is South Korea's second largest city. They have apparently branded their medical infrastructure around a smart city initiative.
Busan is fascinating. They recognized they couldn't compete directly with the sheer academic density of Seoul, so they leveraged their unique geography.
Which is on the water, right?
Yeah, Busan is a major coastal hub with beautiful beaches and a much milder, more relaxed atmosphere. They have invested heavily in telemedicine and wellness tourism. The strategy is to offer top-tier medical and orthopedic care, but specifically cater to patients who want to undergo their post-operative recovery by the ocean.
Oh, wow.
Utilizing smart health monitoring devices while breathing sea air rather than recovering in the hyperdense urban core of Seoul.
I mean, I would absolutely choose to recover from knee surgery looking at the ocean. Moving inland, the guides feature a city called Daegu, and I found their history really interesting. Daegu is officially branded as Medicity Daegu.
Medicity, I love that.
Yeah. According to the sources, they were actually the very first city in South Korea to establish a formal, government-backed medical tourism policy years before the national boom.
Because Daegu was a first mover in the policy space, they were able to carve out very specific, highly lucrative niches early on. The data shows they specialize heavily in hair transplant technologies and complex joint and orthopedic treatments.
Which are huge markets.
Massive. And because they are competing with the capital, they strategically leverage their slightly lower local real estate and operational costs to offer these specific treatments at price points that often undercut Seoul, driving fierce regional competition.
Then we have Incheon. Anyone who has flown into South Korea knows Incheon because that is where the massive primary international airport is located.
Incheon operates on the concept of an aerotropolis, a city designed entirely around the economic engine of its airport.
Makes a lot of sense logistically.
Medically, Incheon is built for maximum strategic convenience. They focus heavily on quick turnaround procedures, comprehensive executive health screenings, and immediate cardiovascular treatments.
So you fly in, get treated, and fly out.
Exactly. If a busy executive is flying in from Singapore for a 48-hour intensive diagnostic workup, or an elderly patient wants to absolutely minimize their ground travel time after a 14-hour flight, Incheon's medical hub is constructed quite literally next door to the runway.
And finally, operating almost as its own distinct medical ecosystem is Jeju Island. Jeju is located south of the mainland, and it holds a massive logistical advantage. It is a visa-free zone for many nationalities that would otherwise require heavy paperwork to enter the mainland.
That visa waiver is a very powerful tool to draw international patients who might be deterred by bureaucracy. Jeju Island is lush, tropical, and heavily resort-driven.
It looks beautiful in photos.
It is. Consequently, their medical sector focuses heavily on wellness retreats, advanced rehabilitation, and non-invasive cosmetic procedures set within luxury resorts. It is the purest distillation of the medical vacation concept.
The national planning required to zone these cities is just incredible. But this brings us to the most critical juncture of our deep dive. You can have the most advanced proton therapy in Jongno, the most beautiful recovery beach in Busan, and the best prices on earth.
Right.
But for a patient sitting in London or Toronto or Chicago, the idea of navigating a completely foreign healthcare system in a language they don't speak, under a legal system they don't understand, is absolutely terrifying. How does a patient know they aren't going to be taken advantage of? Where is the safety net?
Trust is the ultimate currency in medical tourism. Without trust, the entire industry collapses overnight. The PlacidWay resources spend a significant amount of time detailing the rigorous accreditation and legal frameworks South Korea has constructed specifically to protect the foreign patient. This is not a Wild West scenario. It is one of the most highly regulated medical environments on the planet.
Okay, so what should a patient look for?
If you are listening to this and considering treatment abroad, the first and most critical layer of the safety net is international accreditation. And the global gold standard is the JCI, the Joint Commission International.
The guides mention JCI repeatedly. South Korea has over 25 JCI-accredited academic centers and hospitals. But what does getting that accreditation actually entail? Is it just paying a fee and getting a plaque?
Absolutely not. JCI accreditation is grueling. It involves a massive team of international experts descending on a hospital and evaluating them against over 1,000 distinct measurable safety elements.
1,000?
Yes. They don't just look at surgical survival rates. They track the exact pathway of how a single medication is traced from the pharmacy to the patient's bedside to ensure zero dispensing errors.
Oh.
They evaluate the hospital's fire safety protocols, their backup generator redundancies, and their incredibly strict infection control pathways. If a hospital in Seoul has JCI accreditation, it means they are held to the exact same uncompromising safety and management standards as the Mayo Clinic or Johns Hopkins in the United States.
Okay, so JCI proves the clinical safety, but the guides also highlight a uniquely Korean accreditation called KAHF, the Korean Accreditation Program for Hospitals Serving Foreign Patients. And frankly, this one seems even more relevant to the logistics of medical travel.
It is entirely specific to the medical tourist. KHF is administered directly by the South Korean Ministry of Health and Welfare. What makes it brilliant is that it evaluates the hospital specifically on the vulnerabilities of being a foreigner.
What kind of vulnerabilities?
For instance, they evaluate the hospital's cultural competency. Do they offer culturally appropriate dietary options, like halal meals in the cafeteria? They rigorously test the medical translators. These aren't just bilingual staff. They must pass exams proving they can accurately translate highly complex medical terminology in real time under stress.
That is so important.
It is. KAHF even evaluates the discharge protocols to ensure the hospital is providing proper fit-to-fly clearance, understanding the risks of cabin pressure and deep vein thrombosis for a patient flying post-surgery.
That level of granular oversight is incredibly reassuring. But let's look at the absolute worst-case scenario. What happens if something goes wrong? If a patient gets a botched surgery in their home country, they know the system. They call a local malpractice attorney. If a surgery goes wrong in Seoul, a foreign patient would have no idea how to navigate the Korean court system.
The Korean government explicitly recognized that fear as the single biggest threat to their strategic growth engine. If foreigners felt legally unprotected, the industry would die. So they built a robust legal safety net. First, there is mandatory government registration. A hospital or clinic cannot legally treat or even market their services to a foreign patient unless they are officially registered and vetted by the government to do so.
So that eliminates the risk of stumbling into an underground, unregulated clinic?
Precisely. Second, any clinic that achieves that registration is legally mandated to carry comprehensive medical malpractice insurance, specifically designed to cover foreign patients in the event of medical accidents.
Okay, that's huge.
Third, there are strictly enforced price transparency laws. Clinics must publish their price ranges, preventing them from quoting one price to a local and a massively inflated price to a foreigner. But to address your question about disputes directly, the government created an entirely independent body called the Korea Medical Dispute Mediation and Arbitration Agency.
How does a patient actually utilize that agency?
If a foreign patient believes they have suffered malpractice, they do not have to hire an expensive Korean lawyer and navigate civil court alone. They appeal to this government-backed agency.
Oh, that's a relief.
Yeah, the agency steps in as a neutral, heavily empowered mediator. They have the authority to pull the medical records, bring in independent medical experts to review the case, and arbitrate a settlement. It is designed to resolve disputes quickly, fairly, and without the exorbitant legal fees that usually act as a barrier to justice for foreigners. It forces the hospitals to be accountable.
The data also mentions a severe national crackdown on illegal brokers. It sounds like, in the early days of the boom, there were unregulated middlemen who would hang around airports or hotels, intercept tourists, and funnel them to unaccredited clinics in exchange for massive hidden kickbacks.
That did happen in the past, and it damaged the country's reputation. In response, the government criminalized unregistered brokering and aggressively prosecuted offenders. This crackdown underlines the absolute necessity of using verified, transparent, and globally reputable platforms when planning your medical journey, rather than relying on a random internet advertisement or an unverified local broker.
And that perfectly illustrates the critical role of platforms like PlacidWay. Because even with the JCI accreditations and the arbitration agencies, the sheer logistical mountain of planning this trip is enough to make a person's blood pressure spike.
It is a lot to handle.
You have to securely transfer medical records across the globe, coordinate complex international flights around surgical dates, secure specialized visas, and find a hotel that can accommodate post-operative needs. How does a patient actually execute this?
It is a massive logistical puzzle, and this is exactly where a medical tourism facilitator platform stepped in. They serve as the logistical scaffolding, bridging the formidable gap between an anxious patient sitting at their kitchen table and a highly specialized surgeon in a Korean medical city.
I view PlacidWay as a highly specialized healthcare matchmaker. And one detail in the source material I found vital for transparency is that PlacidWay does not handle the actual medical payment. You do not pay the platform for the surgery. You pay the hospital directly.
Right, that guarantees financial transparency.
Their role is to vet the providers, aggregate the data, provide comparative quotes so the patient can shop around, and help bypass the overwhelming logistical red tape.
They remove the friction of discovery and planning. Let's break down the actual patient journey, step by step, to demystify what this experience actually looks like in practice. The journey begins long before anyone books a flight, in the pre-trip phase.
Right. It starts with the initial inquiry. The patient needs to send their medical data DICOM files from MRIs, complex lab work, surgical histories. Through a secure platform, those records are transferred to the Korean medical teams. What happens next?
Once the specialists in Korea review the file, a virtual video consultation is arranged. This is the profound shift in accessibility. You are sitting in your living room having a direct, face-to-face conversation with the lead surgeon in Seoul.
That's amazing.
You discuss your diagnosis, the proposed treatment plan, and your eligibility for surgery. Following that consultation, the hospital issues a highly customized binding treatment plan and a firm financial quote.
If the patient accepts the quote, then comes the bureaucratic hurdle, the visa. Depending on nationality and the length of recovery, a standard tourist visa might not suffice. The guides detail the C33 medical visa.
The C33 is crucial. It is a specific visa category designed by the government for foreign patients. It allows for extended stays specifically for treatment and recovery, often up to 90 days or more.
So you're not just going on a tourist visa.
Right, exactly. But the patient doesn't have to fight the embassy alone. Because the hospital is government registered, they provide an official invitation letter and a certificate of admission, which radically expedites the visa approval process.
So the virtual handshake is done, the visa is stamped, and the flights are booked. Then comes the arrival. And this is where the famous concept of K-medical hospitality really takes over. Because my biggest fear would be landing at Incheon Airport, exhausted, anxious about surgery, and trying to figure out a foreign subway system while dragging luggage.
The system is designed to prevent exactly that kind of stress, because stress negatively impacts surgical outcomes. Upon arrival at Incheon, you are met at the gate by dedicated airport representatives or medical concierges from the hospital.
They literally meet you at the gate.
Yes, they handle the luggage, provide immediate translation services, and transport you directly to the clinic or your hotel in private vehicles. You are fast-tracked through the intake process. The procedure itself happens utilizing the technology we've covered. But crucially, afterward, you aren't just discharged onto the street.
Where do you go?
Recovery happens in specialized luxury accommodations or partner hotels that are physically integrated with the hospital networks, designed specifically for post-operative care.
And before you fly home, you undergo a rigorous final check to receive that fit-to-fly medical clearance, ensuring you won't suffer complications in the air. The hospital also provides a comprehensive, translated digital follow-up plan so your local doctor back home knows exactly what was done and how to manage your long-term physical therapy or medication.
The medical logistics are seamless.
Yeah.
But a practical element that patients must budget for is the hidden cost of recovery. While the surgery is vastly cheaper, you still have to live, eat, and sleep in South Korea for potentially several weeks while you heal.
Let's bring up those cost of living numbers because they are surprisingly manageable. According to the data, if a patient is on a strict budget, comfortable guest houses or business hotels run between $40 and $70 a night. Mid-range, very comfortable hotels are $80 to $150. And if you want the five-star luxury recovery experience, it starts around $200 a night.
Food is also highly economical. Local Korean meals are incredibly cheap and nutritious, ranging from $5 to $10. If a patient prefers Western-style restaurants, they should budget $15 to $30.
And navigating the city, if they choose to explore during recovery, is remarkably affordable. The transit system in Seoul is consistently ranked in the top 3 globally for cleanliness, safety, and efficiency. A subway or bus ride costs roughly $1 to $1.50.
Very cheap.
There are also some incredibly practical ground-level tips in these guides for anyone planning the trip. For instance, do not rely on Google Maps when you get there. Due to national security laws, its functionality is heavily restricted in South Korea.
That's a huge tip.
Yeah, you need to download an app called Naver Map for accurate navigation, and Talk, which is the messaging infrastructure the entire country uses to communicate.
The guide also offers a brilliant piece of practical advice regarding clothing. Pack button-up shirts.
Oh, because of mobility?
Exactly. If you are undergoing any kind of upper body surgery, a rhinoplasty, a shoulder repair, or breast surgery, you absolutely do not want to be struggling to pull a tight t-shirt over your head while in pain or dealing with bandages.
And timing your trip matters. The data suggests aiming for the spring from April to June or autumn, September to November. You want to avoid the summer monsoons, as the extreme heat and humidity can be intensely uncomfortable and complicate wound healing during post-operative recovery.
We have spent a massive amount of time dissecting the macroeconomic systems, the legal frameworks, the geographic hubs, and the technological hardware. But data points and architectural plans are entirely abstract until you apply them to a vulnerable human being seeking relief.
I completely agree.
To truly grasp the impact of this medical infrastructure, we need to look at the human element and the actual patient outcomes.
The PlacidWay materials provide several detailed patient case studies that bring all these statistics out of the spreadsheet and ground them in real emotional experiences. Let's look at Sarah, a patient from the United States.
What was Sarah's situation?
Sarah was seeking rhinoplasty and eyelid surgery. In Los Angeles, after several consultations, she was quoted $22,000 out of pocket. That is a life-altering sum of money.
It is a massive financial barrier. Sarah ultimately utilized the platform to connect with a clinic in Seoul. Her total cost, including the complex surgery, her round-trip flights, and her hotel accommodations for the recovery period, came to less than $9,000.
Wow.
But the financial savings are only half of Sarah's story. What is crucial to analyze here is the technology she accessed that was included in that lower price.
Right, the pre-op and post-op tech.
During her initial consultation in Seoul, the clinic utilized advanced 3D facial imaging. She wasn't just looking at generic before and after photos. She was looking at a 3D projection of her own bone structure, allowing her to co-design the exact precise surgical outcome with the doctor before ever going under anesthesia.
That is wild.
Furthermore, her recovery was vastly accelerated because the clinic's standard protocol included specialized aftercare laser treatments.
How do those lasers work? I've seen them mentioned, but it sounds a bit like science fiction.
They use low-level light therapy, or LLT. Specific wavelengths of light are applied to the surgical site to aggressively stimulate lymphatic drainage and increase cellular ATP production. It dramatically reduces postoperative swelling and bruising in a matter of days rather than weeks.
So it just speeds up the healing.
Yeah. In the U.S., this kind of advanced tech-driven aftercare is often an incredibly expensive optional add-on if the clinic even owns the machine. In Korea, because of the competitive market and focus on holistic recovery, it was simply part of her standard surgical package.
Then there's the story of Ahmed, a patient traveling from the United Arab Emirates. Ahmed's father was suffering from severe joint degradation and needed a total knee replacement. They were facing an agonizingly long wait list in their home system. Watching a parent live in daily mobility-restricting pain while waiting months for a hospital bed is a terrible feeling of helplessness.
The waitlist anxiety is a massive driver of medical tourism. Ahmed utilized the platform to bypass the waitlist entirely and flew his father to a specialized orthopedic hospital in South Korea. And this case perfectly highlights the clinical advantage of the technology we discussed.
The robotics.
Yes, the Korean surgeons utilized a robotic surgical assistant for the knee replacement.
Why does the robot matter so much for a knee?
Precision and bone preservation. A traditional surgeon relies on visual alignment and manual cutting jigs. The robot uses a 3D map of the patient's specific anatomy. It ensures the implant is aligned to the millimeter, and it prevents the surgeon from cutting away even a fraction of a millimeter of unnecessary healthy bone or traumatizing surrounding tissue.
That's incredible.
Because of that extreme precision and minimal tissue trauma, Ahmed's father was literally standing and walking with support the very next day. To go from languishing in pain on a months-long wait list to walking on a perfectly aligned robotic-assisted knee in a matter of days is a profound, immediate improvement in human dignity and quality of life.
The emotional relief of that is immeasurable, and that emotional weight is even heavier in the next case study. Elena, traveling from Russia. Elena was diagnosed with breast cancer. A cancer diagnosis is arguably the most terrifying news a person can receive, and facing it in a medical system you don't fully trust amplifies that terror exponentially.
Elena chose to travel to South Korea specifically because she researched those astonishingly high survival rates and outcomes we analyzed earlier. Her experience perfectly illustrates the power of the integrated digital ecosystem.
How so?
In many fragmented systems, a cancer patient feels like a project manager for their own disease. They have to physically carry their records from the surgical oncologist across town to the radiation oncologist and then over to a separate nutritionist.
Which is exhausting when you are already sick.
Exactly. In Korea, Elena was introduced to the multidisciplinary tumor board approach. She wasn't handed off in isolation. A unified team, her lead surgeon, the radiologist, the reconstructive specialist, and a clinical nutritionist all reviewed her case simultaneously.
All in one room.
Because they all operate within the same physical medical city and share the exact same real-time digital EMR ecosystem, her treatment plan was coordinated seamlessly. She underwent surgery, targeted therapy, and holistic nutritional support without ever having to manage the communication between her doctors.
And how is she doing now?
Today, Elena is 2 years cancer-free. She stated that she felt she was in the safest hands possible because the entire medical apparatus was structurally designed around her survival.
Finally, there is the case of Liam, a patient from Australia. Dental care in Australia, much like in the United States, is notoriously expensive, and poor dental health takes a massive psychological and physical toll. Liam required full-mouth dental implants, a procedure that was financially out of reach at home.
Liam traveled to a specialized dental hub in Seoul and had the entire comprehensive procedure completed for a third of the cost he was quoted in Sydney.
A third of the cost.
But what Liam emphasized in his case study wasn't just the money. He described the clinic environment as looking like a spaceship. He was referring to the ultra-modern aesthetic, the uncompromising hygiene protocols, and the immediate utilization of those CAD/CAM 3D scanners we discussed. He noted the absolute perfectionism of the Korean dental team.
Which ties right back to that cultural emphasis on mastery and grueling fellowship training we talked about at the very beginning. He saved a fortune, accessed better technology, and most importantly, he can finally eat without pain and smile with confidence.
It changes lives.
These 4 stories, Sarah, Ahmed, Elena, and Liam, they are the human manifestation of the PlacidWay data. They represent this incredible, almost paradoxical intersection of massive financial savings, the total elimination of wait times, access to absolute bleeding-edge technology, and a deeply integrated, multidisciplinary approach to human care.
They do. They move the conversation out of a theoretical debate about macroeconomics and hospital zoning and ground it in the tangible reality of human healing.
If you are listening to this and trying to synthesize the massive amount of information we've just covered, here is the fundamental shift. South Korea is not simply a destination for cheap cosmetic touch-ups. Through aggressive top-down government funding and rigorous regulation, they have constructed a globally dominant medical infrastructure.
A true powerhouse.
They have zoned highly specialized regional hubs ranging from the academic powerhouses of Gangnam to the coastal recovery centers of Busan. They provide unparalleled access to robotic surgery, proton therapy, and AI diagnostics. And they deliver all of this at a cost efficiency that makes it accessible to the international middle class.
And crucially, platforms like PlacidWay serve as the essential connective tissue, ensuring transparency, handling the overwhelming logistics, and giving patients the confidence to navigate this global landscape securely.
It is a remarkably robust and efficient system.
But analyzing all of this evidence, leaves me with a much larger, almost philosophical question that builds on everything we've discussed today.
Yeah, it's that.
We have just detailed exactly how a patient sitting in a living room in Los Angeles or Sydney can securely transfer their MRI data via the cloud, conduct a virtual face-to-face consultation with a highly specialized surgeon in Seoul, secure a medical visa, fly across the world for precision robotic surgery, and then manage their long-term post-operative care through a secure telemedicine application.
The entire globe becomes a single hospital network.
Precisely. The question is, are we officially entering a permanent era where healthcare is truly borderless? Because if geography is no longer the primary insurmountable barrier to accessing the best, most advanced, and most affordable medical care on the planet, that represents a massive, historic paradigm
It
shift.
changes everything.
It completely challenges the traditional monopolies held by local and regional healthcare systems. If a patient can achieve vastly superior clinical outcomes for a fraction of the price simply by getting on an airplane, it redefines what it means to be a patient in the 21st century. You are no longer a captive subject of whatever hospital happens to be in your zip code. You are an empowered global consumer of medical care.
That is a profound thought. We started this deep dive by talking about assumptions. We assume that healthcare is inherently local, that when we get sick, the only option is the hospital down the street, and we are forced to accept whatever prices and wait times they dictate.
Right, that's the old way of thinking.
But looking at the infrastructure South Korea has built and the pathways created by medical tourism platforms, that purely local mindset feels incredibly outdated. The landscape of human healing has expanded across the entire globe. The options are highly regulated, technologically advanced, and waiting just a flight away. It is definitely something to think about the next time you or someone you love is told they have to wait 6 months for a life-altering surgery they can barely afford.
Absolutely.
Thank you for joining us on this deep dive. If you're ready to explore medical tourism in South Korea or compare affordable treatment options around the world, visit PlacidWay.com today. Discover trusted hospitals, personalized treatment plans, and global healthcare solutions designed around your needs. Request a free quote. Speak with a care coordinator and begin your medical travel journey with confidence. Be sure to subscribe to PlacidWay Pulse for more insights into medical tourism and healthcare innovation.